My request to all the participants, can you please mute yourself?
Good afternoon, sir. Good afternoon. This is Sujit Ghosh from Tripura, Voluntary Health Association of Tripura, sir.
Yeah, so I request all the participants, please mute yourself.
Rajiv, we can start, please.
Yes, sir. Good evening. I hope I'm audible and visible to all of you, extreme expert and participants. I'm Rajiv Chaudhary, the host of this launch, much awaited online course of Basics of Tobacco Control. In my brief introduction, I would like to tell you that I'm working as a project coordinator at PGI Chandigarh, and also looking after this course as a course coordinator. It gave me an immense honor to welcome all our extreme faculty members, guest of honors, and our participant for the batch 1 on behalf of PGIME Chandigarh. So through this, I would like to invite Dr. Sonu Goyal, Course Director, RCTC, and Professor at Department of Community Medicine and School of Public Health to welcome all the audience and share the brief idea about the course, and also address our online participants. So Professor Sonu Goyal, sir, is a professor at Department of Community Medicine, School of Public Health, PGI Chandigarh, and also an alumni of Johns Hopkins School of Public Health, Baltimore, US, Maastricht University, Netherlands. He holds a 17-year rich experience in the field of public health, and sir has also honored with the Public Health Excellence Award by Honorable Union Minister of Health and Family Welfare in 2014. Sir has fellowship of IPHA, IAPSM, IMSA, and MNASM. So I welcome you, sir, to please address, please welcome the guest and participants.
Thank you, Rajiv. And at the outset, I am really honored to have such an august guest of honors in the faculty of the program from almost all organizations who are working in tobacco control. So I'm really honored to be among them in this August gathering. And I'm also honored to see that in this first cohort of 3 months online course on basics of tobacco control, we have had a huge response of the participants, and in this, around 50 participants we have selected to take this 3 months online course on basics of tobacco control. So at the outset, just want to tell you about this course, because for the experts it is not new, but some people who want to do something on tobacco control but not have done so among the participants. So this course is about learning on what tobacco control is. So why we are doing this course is because every year around 8 million people die due to tobacco and tobacco related diseases. And among them, around 7 million are due to this direct tobacco use, direct smoking, direct tobacco use, and 1.2 million, around 1.2 million due to the secondhand smoke. So, and people over a period of years, when I am working in a medical college, in an institute, I have seen that people want to work in this tobacco control area because it is one of the commonest preventable risk factor of various non-communicable diseases. So we thought along with many other stakeholders here, Dr. Prakash Gupta, Dr. Jagdish Kaur, Dr. Rana Jay Singh, so we all thought that we should start some courses. There are a lot of courses which are there in tobacco control, but they are short courses, and most of them are not practice oriented. So we thought of doing a online course where we inculcate some of the basics of tobacco control. So this course has 10 weeks of teaching and 2 weeks of practicum. So basic objective of this course is to provide you understandings about basics of tobacco control. And there are some
statement అది ఎంత అడ్వర్స్ వస్తాయి మనం ఇవాళ పట్టుకుని మనం రాస్తున్నాం అనుకో అది ఇవాళ
So as I was telling that it provides some basic understanding on tobacco control through case studies, through various examples, and these are some of the modules which we'll be touching upon. That is epidemiology of tobacco, tobacco use practices in India, what are the health and socio-economic consequences and implications of tobacco use, global tobacco control policies and legislation, national tobacco control program, then about our legislation, that is COTPA and related law. Next, please. Then about tobacco cessation, then something basics about tobacco industry interference and role of CSOs, civil society organization and academic institute in tobacco control. So these are the 9 modules will be taught in a period of around 9 to 10 weeks in this basic course. And those people who develop interest in this basic course and want to do further, so we have an advanced course which will be launching soon after this course. And the methodology will be a multi-pronged adult learning approach in which there are some lectures which will be there. There are some assignment which you need to do, and there are some peer review, like the assignments of your peers, you will be reviewing them, and there are some multiple choice questions which you will answer after doing that assignment and about this presentations, and then you will have a chance to interact with our faculty after this. So this is very basics about this particular course, and we'll be starting from tomorrow. Today we have kept an inaugural function for it, and I think after this we'll be having 2 short videos in which we'll be telling you how this course will go. So I again welcome all the participants for the basic course. Thank you very much.
Thank you, sir. Thank you. Now I am playing the introductory videos.
Good evening, everybody.
Thank you. This video is just elaborating the process of how this course will be communicated through the participants. We have a very short 1-minute video.
Hello everyone, welcome to e-learning for public health. I am Dr. Sonu Goyal, working as professor in Department of Community Medicine and School of Public Health, PGI, Chandigarh. Being a public health professional, I am a firm believer of the fact that the development of community rides on its population's health. In the last decade, the healthcare professionals across the globe have witnessed a paradigm shift in the dimensions of contemporary health services. Besides focusing exclusively on clinical medicine, the healthcare professionals are now approaching a coordinated public health response, availing health promotion, prevention of disease, and accessible diagnostic and therapeutic care for all. The past decades also experienced the advent of information and technology, which has revolutionized the world across us. The manual systems has been replaced by computerized systems, giving every individuals an opportunity to explore his or her potential in a new horizons. To make most of the advancement, we were encouraged to transform the conventional method of learning into an interactive web-based knowledge transfer platform. The objective of the platform was to offer online courses to upskill the healthcare professionals. Currently, we are offering 4 courses in the portal, 2 basic courses and 2 advanced courses. The basic courses are of 3 months duration, while advanced courses shall be of 6 months duration, which also includes a practicum or practical exposure. The first set of courses, International Public Health Management Development Program, Basic and Advanced, has been designed for public health professionals involved in planning, implementing, monitoring, and evaluation of projects/programs in government or non-government sector. It aims to enhance the skills and competencies of participants in leadership, team building, planning, monitoring, evaluation, project management, resource allocation, budgeting, financial reporting, total quality management, and public health communication for addressing public health challenges and strengthening efficiency of organization in limited resource settings. The second set of courses, basic course on tobacco control and advanced course on tobacco control, was initiated addressing the need of tobacco control in the country and across globe. Every year, more than 8 million people die from tobacco use, and most of the tobacco-related deaths occur in the low and middle-income country, which are often the targets of intensive tobacco industry interference and marketing. This course will also target the public health professionals, students, implementers, social workers, and people from other backgrounds who want to contribute to tobacco control. A key focus of these courses is to develop the knowledge and skills needed to support tobacco control initiatives in the country, along with strengthening tobacco control policies globally. These courses will offer the basic understanding of fundamentals of tobacco control to the participants and enhance their skills and proficiency in designing and implementing tobacco control programs. Besides, this course aims to build public health capacity of the participants to improve their knowledge and understanding of various tobacco control strategies. The approach used in all these courses will be a mix of learning methods from PowerPoint presentations, group discussion, and informal learning through case studies, exercises, videos, and application-centered learning in form of a short project under the mentorship of a resource faculty of the course. I hope that now you have better understanding of various courses which are offered through e-learning for public health. Please do not hesitate to contact us in case you have any questions or queries which our team will be able to help you out. Looking forward to the active participation in these courses. Thank you.
So after introductions of this portal and the introduction of the course, about the course, so now I move to our next part of the discussion. So I invite Dr. Sonu Goel to facilitate the inaugural discussions.
So I think just in continuity with the two small videos, just want to share that this e-learning for portal health, this portal is a self-made portal. We have not hired any portal. This portal, we have our team have designed this portal, and we are offering this course on this self-made portal. So I think this is the thing, and you can see on your screen, these are the people who are with us. These are our first cohort participants. So for these basics of tobacco control, so we have around 50 participants in this program, the first cohort, and they represent around 16 states of our country. So they are representative throughout. So most of these are actually working in tobacco control, but there are 5 or 6 people who eagerly want to work in tobacco control. They are either doing internship in some organization in tobacco control or some other area, or they are doing they are students who have who want to work on tobacco control. So welcome all the participants. So now taking the discussion forward, I would like to invite Dr. Rana J. Singh, who is Regional Director of Deputy Regional Director in International Union Against TB and Lung Diseases, to deliver guest of honor. This, yes.
So thank you, Dr. Goel. Thank you, Rajiv. Once again, on behalf of e-Resource Center, PGIMER Chandigarh and the Union, I am pleased to welcome all the honorable guests and dear participants. You see how important is building capacity for tobacco control. So at national and sub-national level capacity, it is a key to a systematic multi-sectoral approach to tobacco control. This involves sensitization of whole of politico-administrative leadership in a country or at sub-national level. It involves capacity managerial and technical capacity building of program managers, various stakeholders who are involved in tobacco control.
Yes, sir.
Yes, sir. So in this regard, there are many global initiatives for the last almost now since FCTC has come into being. Article 5 of FCTC clearly demonstrates, clearly tells us that all countries must have all those programs to strengthen tobacco control in their respective jurisdictions. So there are many global initiatives since then for building tobacco control capacity, which includes Institute for Global Tobacco Control, and many of you have already attended those programs. They conduct leadership training in tobacco control, then certificate course, and more recently they have started a scholars program for tobacco control. Similarly, WHO initiatives after FCTC, I think huge capacity building was done by WHO in various regions of the world. It includes almost every region. And in our region, in Southeast Asia region, Bangladesh, East Timor, Indonesia, so they were actually supporting capacity building in these countries. And then Union, I think a huge capacity building initiative by the Union across the globe, in all high burden countries and many more, at almost 70 plus countries, where various technical aspects and various management aspects of tobacco control, people were trained across the globe. So various technical courses includes almost every type of every policy in tobacco control, whether it is Empower as a whole, FCTC Empower, course on smoke-free, course on pack warning, course on taps, on tobacco taxes, similarly various management courses. And in all, I would just like to share with you my experience of almost now 15 years, that in India alone, almost we conducted 70 plus courses for senior and intermediate level officials. That means that secretaries of health, directors of health services, heads of various other important departments, academic institutions, civil society. So huge capacity building program has been done in last 15 years in the country for senior and intermediate level official, and thereafter at sub-national level in states and in districts. I will be very happy to inform you that in last 15 years we have trained more than 5 lakh stakeholders across the country in almost every state, which includes participants from every field, including health, transport, police, major other departments. It includes civil society, NGOs, enforcement agencies. So we had various categories of courses: sensitization and advocacy courses, courses for enforcement, courses for media advocacy, courses for other stakeholders, which also includes Hotel and Restaurant Association, Traders Association, Lawyers Association. So almost we have huge number of participants, almost 5 lakh people who attended these courses in last about 15 years. Then in collaboration with the Ministry of Health and Family Welfare, WHO, National Institute of Health and Family Welfare, National Tobacco Control Program managers under NTCP from all 35 states, they were trained at various places, including NIHFW in Delhi. In addition to that, we are also collaborating with institutions like PGIME at Chandigarh, JPMR Pondicherry, various All India Institutes of Medical Sciences, law schools, then various other public health institutions to strengthen capacity in tobacco control. In short, we can say that there is a huge need Still, I would like to inform you that perhaps we have not covered up almost 10% of stakeholders which are required in across the country. When we are expanding NTCP, when we are expanding National Tobacco Control Program, there is huge need to expand capacity building also. How we are going to do that? It is very challenging. I think this is something which maybe Ministry of Health and WHO country office and other stakeholders, we need to have a plan. I still remember then when I was in tuberculosis control program, in HIV/AIDS control program, we authorized India's primary institutions to conduct that huge capacity building program.
Dr. Rana?
Yes.
Sir, we need to be short, sir.
Yes. So in that way, I think this is something which we need to see how we can involve NIHFW, PEIs, PHFI, NIMHANS, JPMR Pondicherry more vigorously to train all those stakeholders. I think this course is a step in that direction. A very basic course right now. For 3 months, where we are going to cover 10 to 11 modules, and I hope it will be a great learning experience for the participants and they will feel proud to have this certificate. I am very, very conscious of this fact, and they will be very happy to work in tobacco control thereafter. So congratulations to Dr. Sonu Goyal and the team, and all those faculties who participated in developing, designing, and supported in development of this course. So thank you very much. Best wishes. Over to you, Dr. Goyal.
Thank you, sir. Thank you. So thank you for your encouraging words. You had been instrumental in developing this course, designing right from the designing, development, and reviewing this course. So thank you, sir. Now I would like to welcome Dr. Jagdish Kaur. Madam is Regional Advisor Tobacco Free Initiative at World Health Organization Regional Office for Southeast Asia. And she had, again, an immense experience in tobacco control, not only in WHO, but before that in Ministry of Health and Family Welfare. And she had done extensive trainings in various aspects of tobacco control. So welcome, ma'am. So just want to have a few words from you.
Thank you so much, Professor Sonu Goyal and the entire team, and congratulations. And I'm very happy that finally we are able to launch this official course, like this 3-month online basic course, because that had been contemplated for quite some time. And then the entire team worked very hard. And congratulations to the resource persons, also faculty. So finally we are seeing this, and to the first batch also. So we are very excited about this course, and it will give you a basic glimpse of the, what is the tobacco problem, and what are the tobacco control measures. So like Dr. Sonu said that 8 million people every year die because of tobacco use globally. And we have almost 1.3 billion people, using tobacco, various kinds of tobacco products all over the world. And Southeast Asia region, if we speak, we have almost 1/4 of the world's population, more than 80% of smokeless tobacco users, and nearly 20% of smokers. And if we talk about India, so it is the second largest consumer of tobacco. So it is good to know that people are interested, to do this course. Some of them are already working in tobacco control, and many people have showed interest in working. So we need more and more champions at various levels, at the policy making level, at the implementation level, at the grassroots level. And like this year, the World No Tobacco Day, which is coming on 31st of May, the theme is Commit to Quit. And WHO has given a call, to kind of reach out to 100 million people. So that's a big number, and we need more and more people into tobacco control. I'm very happy that, the course is actually now launched, and best of luck to everybody. Thank you so much. Thank you. Over.
Thank you, ma'am. And I must acknowledge here in this gathering that despite her busy schedule, so whenever we requested ma'am to be present in some of the functions and even like reviewing some of the courses content, so she was always ready. Thank you, ma'am, for your ever support for the tobacco control always.
Thank you. Thank you.
So I'm happy to invite Dr. Prakash Gupta. So I think if somebody is working in tobacco control or want to work in tobacco control, know very well about Dr. Prakash Gupta. He is currently Director of Halis Sixeria Institute of Public Health, Navi Mumbai, and holds many academic appointments and at Harvard, TC Chan School of Public Health, Arnold School of Public Health, and many more, and published hundreds of research papers in peer-reviewed journals. And we call him father of tobacco control, basically, in our this thing. So we used to take blessings when we were students. So we used to see up the taller heights, and we have learned tobacco control from him. So, and he has again been instrumental in designing this course, and not only designing, but during reviewing of the courses, like the presentations of the faculty who have come. So he worked very hard along with us in reviewing the entire program. So welcome, sir. And just two words of motivation, a few words of motivation from you about the program.
Thank you very much, Sonu, for that very generous introduction. And yes, I would be brief because the time is only 2 minutes. Congratulate you and your team for developing this homegrown wonderful portal of which this course, tobacco control course, is a part. Heartiest congratulations on that initiative, which has come out so well. I'm glad about this course for several reasons. I will just give one or two reasons. You know, until few years back, whenever I used to talk to somebody, speak with somebody about tobacco control, even with reasonably knowledgeable persons, they would immediately say, yes, we should we should increase awareness. And at the most, yes, we should work in the school. Schools, they must teach about tobacco. And that was about the end of their thoughts and ideas about tobacco control. And I found it very difficult, to take them further. And that was a kind of difficulty one was always experiencing talking about tobacco control. But now with this kind of course, this particular course that is coming through, I think those who are participating and those who are not even participating, but just look at the syllabus and the lectures, they would know the depth and breadth of tobacco control, the topic of tobacco control, and hopefully they will understand and they will get interested. So that is why I am very glad. Of course, one basic course cannot cover all the depth, but as you said, there is a second more advanced course. So I think they together will cover complete depth, breadth and depth of tobacco control. So congratulations very much on this for very much increasing the capacity and understanding of tobacco control, specifically in India in global perspective. Thank you very much, Sonu.
Thank you very much, sir. So again, for your supportive words, and we wish that you continue to mentor us in this course and subsequent courses as well. So thank you, sir. So I would like to welcome Madam Sunila Garg. So now she is National President of Indian Association of Preventive and Social Medicine, a Professor of Excellence and Director Professor and Sub-Dean at Maulana Azad Medical College and Head of Community Medicine there. She's experienced faculty, has led to immense contribution in public health and also in the area of tobacco control, non-communicable diseases, epidemiology, health management, and many more. And she has been advisor to many institutes and organizations, including ICMR, DBT, WHO, and many more. So welcome, ma'am. Want to listen few words of encouragement from you.
Thank you, Dr. Sonu, the director of this course, and then the coordinator, Shri Rajiv ji, and plus, I think I can't see Dr. Amarjit, Dr. Gupta, Dr. Jagdish Kaur, Dr. Rana, all of you and all my faculty colleagues whom I have missed. First of all, dear students, I'm sure you have done a wonderful job by enrolling in this course. So all my congratulations to you. It's a first of its kind, online course with lot of support from the faculty. I'm sure you're going to enjoy this course in a big manner. And this has been a very, very appropriate time because you see COVID pandemic, though it is there, which is not good for us, but we also know, you see, the smokeless tobacco control becomes all the more very important during the pandemic times because this can fuel up the COVID pandemic as well. So I wish you all the best and I will be constantly in touch with you during your course program and all that, and we will be taking up many initiatives with all of you. And since I was also involved in fellowship in HIV medicine, I know the kind of the kick the students have, the enjoyment they have because they go through the course, they go through the exercises, they interact with the faculty and all that. So thank you so much. And Dr. Sonu, I'm sure very soon we will get the accreditation also for this course. So all the very best for the whole program. And all the best to your SCGI Chandigarh, which always comes out with this innovations with the help of strong pillars like you. Thank you so much. Thank you.
Thank you, Madam Garg. And I think this idea of having the inaugural function for this course was yours. And thank you for the support we had. And you had again been instrumental in reviewing the course contents. And I think thank you for your support as always. So
all the very best. I have to leave for another meeting, but I wish my students all the best. And thank you all the faculty colleagues for being, always there in, brainstorming sessions. Thank you so much. I think that it is my course, that's why. Thank you so much.
Thank you, ma'am. Thank you. So we have Dr. Professor Ravi Mehrotra with us. So again, if we talk about part of reviewing team, so he has again always with us as a part of reviewer, and whenever I call him, and he's always there and supported in development of this particular course. He had immense experience. He has been a director of NICIPR and ICMR Institute, and now he has superannuated, and he holds multiple positions. And he had worked immensely in tobacco control, especially the smokeless tobacco, in which he also has a wonderful course on smokeless tobacco and many courses. So he has been now affiliated with many organizations, including York's this thing. So, sir, a few words of encouragement about this course.
Thank you so much, Dr. Son.
Yes, Dr. Ravi, sir, we can't hear you.
And have been with us, guiding us, holding our hand over the last so many years. When I was at NICPR at the global hub, knowledge hub on smokeless tobacco, which really is our problem. And I'm very happy to be associated with this particular course, not only from the point of view of smokeless, but the entire gamut of tobacco control, starting from the basic course, starting from the etiology of how we are, time trusted as well as time honored, international as well as national lessons for their control. I'm also very happy there are more than 60 participants on this particular call, and sure more on your social media. And I also understand that it has been an overwhelming response at the beginner's course. People who do not know about it so far will also increase. It has always been my dream to be part of such a course where so far nothing is really available at the national level. I know there were courses available earlier also from various organizations, but at the national level, sponsored by the government and as well as government setup, I think this is a unique opportunity. And with your stewardship as well as your very efficient team, I'm very proud to be part of that. Participants, all your team, all the very best in as we go ahead in this basic course, to be followed by the advanced and then many other courses in between, in which we'll be taking not just a standard but also out-of-box measures which are personally tuned to the needs. As a unique feature of this particular program, which has not been done earlier, and it will set a mark on which others will be following in the footsteps. So once again, thank you for inviting me and also for making me part of this particular program, along with my very well-known and very, very dedicated colleagues from around the country.
Thank you very much. Thank you very much, sir, for the motivating words. And again, you had been with us throughout this course since it started developing around 4 to 5 months back. So thank you, sir. Want to briefly invite Dr. Arpit Gupta, first from Jaipur and then from Punjab. Just a couple of words about the course and how do you see this course for the students? First from Jaipur, Dr. Prakash Gupta.
Yeah, thank you, Dr. Sonu, for your opportunity that you have given, and also huge congratulations for this course, which I think definitely provide us the much needed human resource that this country needs at this juncture, because we do have we do have the need for it in a way to progress further from where we are at the moment in the tobacco control and the huge burden of the morbidity and mortality that we have. I consider that the standardization that you have done, the modules in which these have been structured, the review which has been done, I consider these are all making the course unique in so many ways, and I'm sure it will sustain for a long time to come and will provide the human resource that we need in the country. So thank you very much. I wish you all very best, and also wish the participants a very unique and significant experience which they will be able to utilize as we hope them to work in tobacco control with the commitment. And I consider the passion comes in once you are oriented to this subject. So wish them all very best. Thanks, Dr. Sonu, again.
Thank you, sir. Thank you very much. Dr. Prakash Gupta from Punjab, sir.
Yeah, Dr. Sonu. So congratulations to you, all the resource persons, and to the wonderful team you have. And I'm sure the participants will gain a lot. And this is actually required because tobacco control is such a subject that only passionate people are involved into it. But there are so many nitty-gritties involved in tobacco control, and people, they really need to know about it. So congratulations. And the format is really beautiful. I just watched the videos. Both the videos are really very well made. And congratulations for that also. Thank you.
Thank you, sir. Thank you for your support as always. We have designed this course in such a way so that we have academic partners as well as NGO partners who gel together to design this course. And Dr. Ms. Shering, I think is with us. So Shering, can you share your experience?
Hi, Dr. Sonu. Hi, everyone. Good evening. So no, I don't have much to share. And in fact, my apologies, because when this course was designed and it was at initial stages, I lost my voice because of some issues, because we were mostly online, and that's why I could not participate, physically. But then definitely my colleague here, Abhiram Mendre, is part of the faculty who is there in the course. And there, of course, he and I had discussed a lot of things, and that's my contribution. And I would like to congratulate everyone here from those who were involved in conceptualization as well as now will be involved in the implementation. Congratulations, Sonu, and congratulations to the entire team. Thank you.
Thank you, Shering. And I think your leadership, under your leadership, the module was developed. So I must appreciate your contribution for the entire work which has been done in development of that was there.
Oh, that's so generous of you. Thank you so much.
We have Dr. Sitanshu Kar, who is our academic partner, not only here in this particular development of the course, but also we are running many tobacco control projects together. He is a professor in JIPMER, Puducherry. So, Dr. Sitanshu, can you say 2 words about your experience?
So thank you, Dr. Sonu. As usual, you always put us in a very tight spot with a lot of hard work and a lot of unexpected things. Thank you so much, and I must congratulate the whole team. It has been a wonderful journey, and we have been working for almost now 6 to 7 years in this area of capacity building. And JIPMER also runs a program on that. I congratulate all the participants who have joined this course, and we look forward to the interaction with them in future. We'll be always there to support you in all your all the endeavors, and we'll try to help this young lot of 50 participants to take them forward and be the tobacco champion in this tobacco control champion in this country. So thank you so much, and congratulations once again.
Thank you for Dr. Sitanshu. And I think you have been instrumental in developing this course since we started. So thank you. We have a young dentist who is with us, who although young, but holds like many positions in Indian Dental Association as well as community dentistry, Dr. Arpit Gupta. So Dr. Arpit, so can you say a few words about or whether what is the need of this program?
Yeah, hello everyone. First of all, I just want to congratulate the whole RCTC team and other dignitaries who have worked so hard. And also I wish to congratulate the participants who have made up to this first 50 cohort. Well, I mean, cohort of first 50 people. All know, I mean, we were, it was in high demand, and still I'm getting calls from many of people who are willing to do this course. So probably they have to wait for a few more months to get themselves enrolled. All I want to say is that every lecture, every assignment, everything in this course has been curated so well, and a lot of brainstorming has gone through each and every step. So that is the beauty of this course, and we have all the stalwarts from the country, all the experiences from various universities, let it be the John Hopkins or the Harvard or many other, WHO, Ministry of Health and Family Welfare. So this resource center has tried to amalgamate all the available knowledge, and it is in the form of a capsule that is being delivered to all you participants. So congratulations once again. Thank you.
Thank you, Arpit. Thank you for your words. So we have many faculty here, but in the interest of time, just want to invite our the young union team. I think Dr. Amit Yadav is with us, and we have other people. So maybe Dr. Amit, can you speak for the entire team of union? Although Dr. Rana has spoken about it, Dr. Shivam and Amit, either of you. Dr. Amit?
Thank you, sir. Thank you so much. Thank you for giving this opportunity. And I think it was a pleasure to be part of this important course and to contribute the unit on or module on tobacco control laws, and also a learning experience. Recording your own session and providing assignments and questions, in terms of, and also in terms of given format, then the whole e-learning platform. So this is something I think a unique experience that I got from this whole process, and I think it is going to be state of the art online course. I have done a couple of Coursera course, and I think this is going to be on the same lines, and it is really in terms of coming out very well. I think in the last facilitators meeting, the coffee table talk, I think there were a lot of good suggestions, especially from Dr. Upendra Bujani, allowing people to do it at their own pace, and in terms of evaluations and other things. I think it is going to be really very good course at the end, and people will love it. And it's really, it's time to congratulate also all the experts who contributed to make this possible, and all the first batch participants, or I could say candidates for this course. I think congratulations to all of them for this unique course that you are going to take, and it's a very, in terms of it's a soft dose of tobacco control, and tobacco control is addictive, and we hope that all the candidates will get addicted to tobacco control after this course. And a huge congratulations and I think applause for Dr. Sonu and his team, especially Rajiv and Kanika, for actually being behind us and telling us to complete it on time. And I think all other people would have, faculties would have heard from them, and they have been really very, in terms of accommodating and accepting all our demands and all our tantrums, I should say. We have been not very punctual with our work, but then I think at the end this has been really very, very great. And we'll be happy to contribute further, and looking forward to learn more. And I think Dr. Shivam will be talking for himself, and I think his experience also as an as expert from his field but I think it was a good experience. And from union's perspective, I think we one of our major areas of work is capacity building and training. And I think this course is going to really build a cadre of trained tobacco control experts in the country and globally. So this is really a very good work. I think the resource center supported by union and also PGI's contribution. I think this is really going to be a game changer in tobacco control education and training in the country and also globally. Yeah. Thank you so much, Dr. Sonu, for providing this.
Yeah, thank you, Dr. Amit, for such a kind words. I know that we were after you, despite all your busy schedule. Not only you but other facilitators. Our team was after. We are troubling again and again, asking for a revised presentation, asking for assignments, asking for so many things. So I think it was really a troubled time, and despite in this challenging times of COVID-19, I think we were blessed that we have been accommodated by all of you. So thank you. Thank you. So Shivam, do you want to add upon it just quickly?
Thank you, Dr. Sonu, sir. And I think as Dr. Amit has already said a lot of experience sharing. And I think for me, as a young professional, coming and learning with everyone has been quite an experience. I myself have done similar courses in the past. Few things I think regarding the professionalism of the course, I think it has been tremendously amazing. Yes, the technologies which are incorporated, I'm sure, because the participants in the course I was just looking at, it's a mixed bag which we have got, and I think that's the kind of response which we can tag and quote as a success. And I think we are each of us are learning from each other, and I'm sure after the basic course, everyone would be really thrilled to be a part of the advanced course as well. So yeah, I think that's my 2 cents. So yeah, thank you so much.
Yeah, thank you, Dr. Shivam. Thank you, Dr. Shivam. I think wonderfully well. I have with us my colleague who is a psychiatrist, and we have been working for quite some time on cessation here, Dr. Abhishek Ghosh. So he's a faculty in Department of Psychiatry, and he has contributed in this development of the cessation module along with Dr. Prakash Gupta and others. So Dr. Abhishek, can you say something about this program, the need for such programs?
Yes, sir. Thank you very much, sir. Thank you, Dr. Sonu and the team, entire team. I feel very proud and privileged to be a part of this course, to be one of the facilitators of this course, and it has been a learning experience for me as well as a young faculty member. As someone has just pointed out, I think Dr. Shivam has told that for us who are relatively new in the field, we have the opportunity to learn from people who are experienced, and you and the entire team have done a tremendous job of having people from across specialty, subspecialty. There were experts from public health, from social sciences, from medicine, from policy making, ministry, and psychiatry. So kind of it's an amalgam of all those experts who could be involved in tobacco control. It's kind of a one of its kind program, and it was very well organized, well designed, and I hope all those who have joined, they will enjoy the program and they will learn from it and implement it in their future life. Thank you very much.
Thank you, Dr. Abhishek. Thank you very much. Another colleague, Dr. Ravindra Khewal, an environmental expert, and again his name has come in the top 2% of researchers here recently. So just a few words, Dr. Khewal.
Thank you, Dr. Goel. It's a, I will say, star of, you are having all a star in your bucket, basically, and I'm pleased to be one of them. So thank you. And what I could say that the session on environmental health risk assessment, basically the risk assessment, the second-hand tobacco smoke, this we contributed, and we are sure that with the input of other colleague, we will make it more useful and more practical relevant. And that was the key actually, which you initiated, and along with the, I know Dr. Rana Jaising contribution and Dr. Rakesh Gupta contribution. So with their input and with, I can say, the demand which was generated to us, made this course very wonderful, and we are looking forward that how we can do the risk assessment while doing the tobacco control activities. Thank you.
Thank you, Dr. Ravindra. Thank you very much. Dr. Kamlesh. Dr. Kamlesh, few words from your end, because you are not only an implementer, but also a community medicine professional. Yes.
Thank you so much. And I thought this paucity of time will not allow me to, so that I text my messages actually. But thank you very much for giving me time. Dr. Sonu and Rajiv and Kanika and other team members who are very much involved in this whole process, design initiative of the country on tobacco control. It's a knowledge hub right now. And we can say it across the country, every people who will be part of this tobacco control will have a network with you people. It's a very great initiative, and it's my best wishes as a nodal officer, as a colleague, and as a one of the public health person, practitioner. It's a wonderful initiative, and the design is very nice. And I would like to always help in this regard whenever the knowledge dissemination process will be happen. Again, I wish the entire team for a best success. Okay, thank you so much to all the members who were involved in this process. Dr. Sonu, is a special thanks to you for a wonderful initiative.
No, I think that you deserve thanks, because you had been instrumental again, not only in this thing, designing, but also thinking of taking this course forward in the state health system. So before we launch and we'll have a group photograph, last words from Dr. Gopal Chauhan.
Sir, thank you very much for giving me the opportunity. I think this is a wonderfully designed. With time, we need to learn from the participants they want from us. And I think that we can do better in the coming future with such experience. And I think that I am strongly believing that we will be combating tobacco and next few
Thank you.
years. Thank you very much.
Thank you, Dr. Gopal. We could barely hear you, but I think we can get the essence of what you have talked about. I think you had been working for quite some long time in tobacco control in Himachal Pradesh, and I think your experience in this course was really very valuable. So before we have a group photograph after this, so we would like to have a release of our 13th edition of Tobacco Free Time. It's a bi-monthly newsletter which we publish every second month in some of the functions. So we thought what a function can be where we have almost all experts who are there in tobacco control, and also the participants of the first cohort of tobacco control. So let me tell you that this tobacco free time is about, I think, let us first release. So maybe everybody can unmute themselves and say at once, unmute release, and I'll say release, and then everybody say release, and we'll have a release. So organizers, can you unmute everyone?
Yes, everyone have a power to unmute themselves.
Okay. Yeah. So fine. So release of the newsletter.
Release.
Please. Right. Thank you very much. So this particular newsletter is about women and tobacco. We held a seminar or webinar some time back on women and tobacco. Madam Meera ji was there, and many other people who are part of this particular webinar was also there. So this is about how to tackle this women issue separately. So we should have policies. So there people have given the recommendation in FCTC, in Empower, in our national programs, where the role of how we can involve or how we can have a gender neutral, gender specific policy in tobacco control. So maybe this is just about the glimpses. And Madam Preeti Sudan, who was a former health secretary, was the chair of this particular webinar. So maybe we can have this. So we can, you will have a link. You can go to the RCTC website, Resource Center for Tobacco Control, and you can just have a link about that. So it is present there. So this is about women in tobacco. Why focus on women? What is the worldwide burden? What is the burden of tobacco among women in India? What are the roots of tobacco uptake among women? What is the level of SHS? Why negative impact in more among women? And why tobacco addiction is stronger in women? And what are why the cessation services are less effective among women? So there are some of the things which are already there in this. And I have yesterday seen that Dr. Meera Agi and Dr. Prakash Gupta has also developed an article on women and tobacco. So thank you. Next, please. I think, yes, we can. Now I request everyone to, before this, I request everyone to switch on their cameras. We'll have a group photograph of everyone. So all participants can switch on, all participants and facilitators, please switch on your cameras. I think this is a wonderful moment in which we have people who are experts in tobacco control, and there are people who want to learn from tobacco control. I think for the students, it will be a memorable time in which they are able to click the photograph with the experts from across globe who have been working very hard, who have immense experience in tobacco control. So maybe we, I request everyone to kindly switch on their cameras. Maybe you can switch off your, you can mute yourself, but you can switch on your cameras. And Rajiv, Anuj?
Yes, sir, we are doing.
So when it is done, Rajiv, please tell us.
Done, sir. Done, sir.
All screens?
All screens, sir.
Okay, thank you very much. I just invite, I want to invite just one participant just to tell about the course expectation, and after this we'll be having a separate session for the participants, and then we'll because the faculty have spared their time. So just one participant, maybe I think we can invite Mr. Raghunandan. Mr. Raghunandan, can you just speak on behalf of participants? You can unmute yourself. You can unmute yourself. You can unmute yourself. I think it's muted.
Sir, good evening. Could you able to hear me, please?
Yes.
Yes.
Sir, good evening, everybody, and good evening to especially Rajiv ji, Sonu ji, who is the greatest personality of tobacco control. And I cannot take the each and individual's names because all are the great personalities for this mission on tobacco control. Really, I am very, very grateful to being a part and taking part in this prestigious program. Actually, since 3 days, you believe it or not, entire the Hyderabad media has emphasized the importance of the course, because being an officer of Telangana government, I dedicated my life since 20 years to tobacco control. And my father was also a teacher. He also helped a lot of so many persons. And an officer, I have served for so many districts in the Telangana. So I helped a lot for so many farmers and labor to turn as non-smokers. So till also I am writing Panchanaba in the police station because I have seized a lorry rice which is going to illegal transportation, and I am talking to you. So since today also I have you just listen me carefully. One of the person who is suffering from COVID, he has asked to hand over a tablets of the COVID. So just I requested him that I will help you, but please promise me that you will make 3 persons to non-smokers and tobacco control monitors. So he surprised everybody expects some money or some otherwise help, but you, sir, you are a model one, and you are pledging myself to become a tobacco controller. It's shocking in my life. I cannot see this step because today I told there is a good event launching today evening at Chandigarh by Resource Center for Tobacco Control by eminent persons for the tobacco control mission. So this is the good forward in the nation to make the nation a tobacco free India and for tobacco free generation also. So it's a really, I could not express some of my feelings in words because so many participants are fluent in Hindi and some are in English also. But I am expressing my feelings from my heart that it's a feast, it's a festival to all of our tobacco control stalwarts, which the opportunity has.
Thank you.
And so many personalities. Thank you, sir. I cannot say how can I to all those stalwarts, sir.
Thank you very much.
Thank you, sir.
Thank you very much, Mr. Raghunandan. I think I can understand your emotions, and I understand. I hope that you will go better learned after this 3 months of course, and you will be able to make more people quit tobacco. So I think
Yes,
thank you very much, and maybe I think we will have the detailed session with the course participants after this. So maybe I'll now invite Mr. Rajiv to say vote of thanks for.
Thank you, sir. Thank you. And thank you for giving this opportunity to propose vote of thanks. It's a wonderful launching today, and we committed to provide quality education to all the participants. I would like to thank our dignitaries, our guest of honors, Dr. Rana J. Singh, Dr. Jagdish Kaur, Regional Advisor Tobacco Free Initiative WHO, Dr. P.C. Gupta, Director, Health Saskaria Institute for Public Health, Navi Mumbai, Dr. Sunila Garg, National President, Indian Association of Preventive and Social Medicine, to provide their valuable comment, along with the various faculty member to provide their the motivational word to enhancing and launching this online 3-month course. So thank you all the faculties and all the dignitaries to giving your valuable time for this particular and important occasion. And we are committed to have this wonderful 3-month course and to make this these participants to tobacco control leaders. Thank you.
Thank you, Rajiv. So I think last this thing for faculty. For faculty, we have a separate ID and password which we have given to all the faculty. They can just go to their profile, and afterwards they can edit their profile. They have a separate page, and whenever there will be a session, live interaction session, so they can join through that particular link. So we will be sending you that small video in which for the faculty, for every faculty. So now the participant can stay, and I again thank all the faculty members, all the guests of honors who spared their time during this evening after a long day. So thank you very much, and I wish that you all will be with us through this entire program. The participant can stay because this is a query session for the participants, and from tomorrow the course will be starting. So I also like to thank here my entire team led by Mr. Rajiv Kumar, Dr. Nidhi Jaswal, who is with us, Dr. Kritika Upadhyay, Dr. Kanika, Mr. Saurav, Mr. Anuj, Mr. Arjdeep, who has done lots of hard work in this. Every day we were having a meeting, every second day we were having review of the portal. So I thank you all. So thank you again, faculty members.
Okay, all the best.
Thank you, sir. Thank you very much, sir.
All the best.
Thank you, Dr. Kamlesh.
Thank you.
So do I start the introduction to the portal with the participants?
Yes, yes, you can start.
Okay. Anuj, can you move the next? Yes, so after the launching of this important course, so we have just introductory slides for all of you. So we have a schedule, like introducing you the schedule of the course. So this is a summary of that. After this slide, we are like briefing all of you on a daily basis program. So the weekly program, but we expected from all of you to spend 3 to 5 hours. So 3 to 5 hours, particularly on the Tuesday is for the lecture announcement, and on the Saturday we have, during this Tuesday to Saturday, we have assignments, 2 assignments to all of you to need to submit on the Friday, and the peer review process you need to complete Friday and Saturday. And Saturday in the evening we have a live interaction with the concerned faculty. So the unit faculty will be there to interact and solve your queries, what you have listed during the lectures. And after the live interaction, we have a day, Sunday and Monday, and to the revision of your content. And after that, we have scheduled your module exit exam on every Monday in the evening, 5 to 6 p.m. So, and the thing is, like the participants can access the lectures anytime after the schedule. For example, we have scheduled the lecture on Tuesday, every Tuesday, but you can access the lecture on the portal from Tuesday till next, whenever the course is completed. Anuj, can you move next? Yes, so this is a breakup of all the weekly schedules. So once we have completed the launch of this course today, after that, on 4th May, we have scheduled the lecture in the evening, and 6th May, you need to submit 4th, 5th and 6th, you need to submit the assignment given, and assignment will be visible on the portal. After that, you have the internal process of peer review. So what we have like we have decided to have the cross peer review across the participants only. So after submission of your assignment, you receive the 2 peer review, the assignment of other people, and you need to like review the assignment and give the rating of that. So in Friday and Saturday, you need to provide the peer review process. On 8th, it means the Saturday we have scheduled the live interaction with the faculty of module 1. That is scheduled in the evening only, 5 to 6 p.m. And on Monday, coming Monday, is the module exit exam. So we have scheduled the module exit exam. So this process is always similar to all the module process. So you need to follow the same timelines, same structures to execute your process of the course. So that is similar to the module 3, 4, module 5, module 6.
Rajiv?
Yes, sir.
Yes, so I think just to make people understand, so I think this is very clear. So our module starts on Tuesday. Every module will start on Tuesday, every day.
Yes, sir.
So every week. So on Tuesday, everybody should be ready at 5 o'clock. So in your calendar, put that time of 5 o'clock sharp, in which we'll be starting our lectures. So from 5 o'clock to around 6 o'clock or 6:30, there are 2 or 3 small lecturites, which last for around an hour or so. So there will be lectures, and then we'll be giving you a small assignments on Tuesday itself. And you need to submit that small assignments. 2 assignments are there. You need to submit those assignments by Thursday. And on Friday, you will also have the opportunity to review 2 assignments of your peers. So that you again need to submit on Friday. And on Saturday, you will be interacting live with the faculty, in which you can ask questions, you can ask whatever query regarding that. And on Monday, we'll be having that exam. And from Tuesday, again, the module will start. So this is how the entire thing goes. So we'll be circulating this schedule, and also we'll be giving you the entire thing. And for benefit of those, like today somebody was asking about WhatsApp group. So we'll be having the two types of WhatsApp group. One WhatsApp group in which we'll be passing you information. You will not be able to post anything. So that will be for the entire group. All 50 people will be there in that, and we all will be there. So it is only us or the organizing team who will be passing the information. But there will be a second WhatsApp group in which for every 8 persons, for every 8 or 9 people, we will be having one sort of coordinator among yourself. So we have decided the coordinator. They will form the WhatsApp group, and they will keep on interacting with the people, with their own participants in that group. And again, during the interaction, whatever queries they have, so they will suggest us that these are the queries which have come up during our session, so that it will not be disturbed. So this is how the things will go. Okay, so I think Rajiv, you can go further.
Yes, sir. So after completing the module part, so we are in now the practicum work. So after completion of these module exercise in nine weeks, so we have left with 3 weeks for the course. So the first 2 weeks is for the practicum exercise. So tentatively, we have scheduled on 6th July. We will be given a project work assignment assigned by the course faculties. So you need to choose the activity from the available course faculty and submit it by the next two weeks. So tentatively 17th July is a submission for the project work. After you submit the project work, our facilitator and the faculty will review your project work and rating your exercise, rating your project work, and you may get the result of project work by 24th July. And after the rating of and clearance of project work, after approval, you need to assess the post test exercise. So you do not have the privilege to complete the post test before completing the project work, because project work is a compulsory exercise to reach the post test exercise. And post test tentatively scheduled on 26th July. And after the post test, you will get the result on your screen after the post test, and you need to provide the feedback form available on the portal. After the feedback, you will be available to download your certificate from the concerned portal. So these all are the compulsory activities you need to complete. One is project activities, project work. Second is post test, and third is feedback. After these activities, you will be able to download your certificate. So now I move to the process, the long process, step by step, to guide to the course. So next, like after the enrollment, I hope you all have received login credentials in your email today. So if not, do confirm us. If not, so you just check the login ID and password given to you. So you just reach the available web link, website elearningforpublichealth.com. So just login area, just click on the login area. Do not go to the facilitator login. You just go to the login area and like write your login ID and password. So after sign in, you will be there is a course name. So you just click the course on basics course on tobacco control and click on the start course. After clicking the start course, you will have a different window on your screen. There is a dashboard and complete content of the course. So once tomorrow you will start this course, so you will need to fill the pre-test exercise before starting the lecture of this one. So we may able to start the pre-test before the lecture, maybe 1 hour back. And after the pre-test, for example, you need to click the pre-test and there is a view action. You just click the view and there is a MCQs for the this one, the pre-test exercise. You need to choose, click on the right answers and go for the next. Skip and next, sorry, save and next is an option. Okay, when you want to skip one question, so then click on a skip and next. And if you want to go back, just click on a previous, and you can, and like there is a side box, number of question is there. So you directly go to the number of questions. If you want to go directly to the 10th question, you just click on a 10 and you may back to the first one. So this is after the clicking on all the right answers, you need to click a finish this exit exam pre-test, and after that you will be able to see your result in front of you. After the pre-test, you just click on the module 1. So module 1 will be scheduled tomorrow in the evening, approx as already said, the 5 o'clock in the evening. So when you click on the module 1 title, so you go to the title presentation. So there is a 2 module in the module 1, 2 unit, 1.1 and 1.2. So once you reach this place, you just click on the presentation. So when you click on the presentation, there is a video presentation here, already recorded video presentation. You need to complete the video presentation. There is a suggested material also along with the presentation here. And you need to complete both the presentation by tomorrow only, once you start the video lecture. So after this, you will be have a assignment. Assignment is already assigned to you in the evening tomorrow. So you need to see the assignment questions and respond to the assignment questions. After clicking this view option, respond to the assignment and submit your assignment by the given timeline. We have provided a two day for the assignment. So we have 2 type of assignment here. One is based on text written assignment, and second is a video based assignment. So we will be elaborating the video based assignment with you on the portal also itself. So once you complete the assignment, for example, you need to write something. If you do not write on the portal directly, you have that written material of your assignment on the Word file, maybe on the PDF file. So choose that file and submit the assignment along with the attachment. And then click the submit of assignment. So if you do not submit, then they will reflect the pending only. So you need to submit this, then you move to the module exit exam. So schedule is already making. For example, we have already make the schedule of the assignment, 3 days, and then peer review, then live interaction, then module exit exam. Yes, so peer review is there. So once anybody can submit, automatically you have received one the assignment of other peers, and you need to provide the feedback on clicking the give feedback option. And back to the modules, and then you need to visit the live interaction area. So we have scheduled on every Saturday, we have scheduled the live interaction with the concerned faculty. The link of the live interaction is be available on the portal directly. Once you click the view option, you will have the live interaction meeting link. So the Zoom will be used for the live interaction meeting. And then a module exit exam, you need to click on the view and choose all the correct answers. And yes, before starting this assessment instructions, module exit, there is these are the following instruction is there. Start on the click start exam option. And then once you complete your complete your the exit exam MCQs, then click on the finish exam, and then you move to the next module. So there is the same process will follow in all the modules. There is all module is there. So you need to, once you complete the modules, they reflect the status of complete. If you're not completed this, they're reflected on the uncompleted, pending. Status is pending. So you need to complete all the module exercise. After the module schedules, so you need to visit the practicum project work. So just click on the practicum project work. So there is a list of facilitators here. So you need to choose the facilitator and the listed activity by the facilitator. So you have an option to choose the activity itself and the facilitator itself. So choose the activity. Once you submit the 3 activity on your choice, so that it will come up to the organizers, and organizer will approve your activities as per the requirement of the faculty and as per the requirement of your. So once we approved, and you start the working the project work and submit your project work after completion of this. So after submitting your project work, your has been submitted to the facilitator for, so your project will be submitted to the concerned faculty for their approval and rating. So once you get the rating of facilitator on your project work, then you move to the next step. So next step is post test. So after completing the project work, you move to the post test, click on the post test, and then click on the view option here in front of post test. So it is a similar process as look as the process of the module exit exam and pre-test. You need to click on all the correct answers and then move to the next. So there is a catch of qualified exercise. For example, we have kept a 40% passing mark for this post-test exercise. So you need at least, we have kept the 3 attempt for you, and you need to clear the 40% passing mark, and then you move to the feedback form. So click on the feedback after the clearing this post test, and once you complete the feedback exercise, you will be able to download your certificate successfully. So this is, I suppose this is a whole process. You can explore the portal for more information, and anytime we have already created a WhatsApp group for you. And if you want to have a queries, so we will be addressing your queries simultaneously, as already mentioned by Dr. Sonu Goyal. So we have even creating some the coordinator for the small group of the team, and they will be addressing by us all the queries. So for checking your progress, you can click on My Progress button from the profile sections, and you have a separate profile section, My Progress, and other features available on the portal. So I suppose this is a whole process. You may be clear about the process. If you have any query, please ask us.
Hello,
Yes.
sir.
Yeah. Yeah,
I'm
Shanti. Please
yeah,
ask.
I'm Dr. Shanti, sir. Hello.
Yeah.
It's lovely to be a part of this course, sir. First, I'd like to thank all of you for taking so much of effort in planning the course for us. I just have one issue, sir. My
Yeah,
work
please.
completes by about 6:30 in the evening every day. So every day. So is it possible for me to take the exit exam slightly late than what is scheduled? Is it okay? Or is it compulsory for me to take it at that time only?
Exit exam, we have scheduled the fixed time. But if in case, for example, if you have accessing problems, so we have a privilege
sir.
of some time. We have some privilege of some time. But
Okay.
if possible, please try to have the exit exam on time. And other
Okay.
things are, maybe you may be able to assess the lectures on after the scheduled time, but the
Yes.
exit exam will be scheduled on similar time. But yes,
Okay.
because we know the internet sequences, so you have a privilege to have the MCQs by late by 1 hour, yeah, half an hour only.
Okay, not more than that. Or
Not more than, yeah.
okay, because I have this issue, sir. I need to come back from my work and do it at home. So then kindly let me know if there is any chance for me to, if there is any way that you can help me in this situation, sir.
Yeah, we will respond to you separately on these issues.
Yes, sir, please.
Thank
Sir.
you, Dr.
Thank you
Santi.
so.
So, any other concern by any of the participants, please ask regarding the process of the whole course execution. I hope that everyone are very much clear. Yes. Anyone have any questions? Please ask.
Hi, sir. This is Mahantesh from Karnataka.
Yeah, Mahantesh, please go ahead.
Is there any chances to attend that course if I have another meeting and at the same time, or else not possible to attend that same day that course? Is there any chances to attend for the next day that Monday course?
Yeah, I have already mentioned that the whole process is on demand base, because we have our initiation time. But yes, for the exit exam, you need to be there. You need to be there, and for lecture, you can assess lecture at any time, any point of time, maybe in the late evening also.
Okay.
Yes. So, yeah, any other queries by any of the participants? Please come forward. You all have received the login credentials in your email. Please
Yes,
respond in chat.
Yes, I have received.
Okay.
Yes, sir, I have received.
Okay.
Yes, sir, received.
Yes, sir, received.
Okay. So I hope everyone can have received. If you do not receive, they are probably not working your logins. You can able to change your password also. Okay. Do change and you can access your profile. But everything is scheduled time. We have scheduled all the lecture on weekly basis and every activity as per the time. So you can assess the lectures, but it come a wonderful course for you people, Yeah, so I hope you all will be able to listen the concerned faculty, because we have gathered a faculty from across India as well as the internationals. So they teach you on all the topics as given in the presentation and the brochure of the course. So if nobody have the questions, so do we move ahead and close our today's discussion? No question from the participant?
Yeah, Rajiv, I have one question. Till now, I'm
Yes,
not
yes.
getting. Yeah, I'm not getting my password and then user ID.
Okay, so I will check with your logins. Other than this, sir?
Myself, Premjit Thousand from Manipur State.
Yes, sir, Premjit ji. Yeah, I'm sending you the logins if you not have received.
Yeah, sure, please. Yeah, thank you.
Yeah.
Yeah, myself, Dr. Suresh Kumar. Even I have not received the login credentials, please.
Okay, Suresh ji, we will provide you also. Thank you. Yeah, we will provide the video link also, all helping video links, and the video link is already available on the portal also. You can access the guide option is there, so you can access the video link here only. Okay, so no questions from anyone? Okay, so this type of meeting we have schedules only the live interaction on weekly basis. So we may have the face-to-face discussion on Saturday only. The next meeting will be on Saturday, coming Saturday. We have a module 1 faculty to discuss your queries and questions and addressing your implementation queries also during this one. So as this is the web-based portal, and we are also doing on the first time, so we may expect some hurdles, but we are fix up all the hurdles before execution of this particular portal. So thank you everyone to join this the inaugural discussions, and we expect all of you to make actively participate in this particular course and address the issue of tobacco control in your area. Yes. Yeah, Raghunanda. Yeah, please go ahead. Raghunandan ji, you have any questions? Okay. So I suppose no one have any questions till the time. So maybe on Saturday you may discuss on the queries. So thank you everyone for joining today's sessions. We will meet you again on Saturday, and before that you can access easily the portal from tomorrow. Thank you all. Thank you.
Thank you.
Thank you, Rajiv ji.
Thank you.
Thank you, sir.
Thank you, Nipal ji. Thank you.
Thank you. Thanks a lot.
Thank you.
Thank you, Rajiv ji.
Thank you, ji.
Thank you, Rajiv sir.
Okay, Sunil ji. Thank you.
Thank you, Rajiv.
Thank you, Subhita Patil. Thank you.
Thank you, sir.
Thank you, ji.
Thank you, sir.
Thank you, and bye-bye.